Ladies and gentlemen, very good afternoon. I'm Georgi Chaltikyan, Professor and Head of Digital Health at Deggendorf Institute of Technology in Germany. It's my absolute pleasure to try my best to moderate this interesting panel this afternoon titled Diversity, Equity and Inclusion in Data. And thank you all for joining us here. Thank you to our audience. And of course, it is also my pleasure to thank the organizers of Med-Tech World for inviting me to moderate this panel. Well, there's no doubt that successful implementation of digital health and achieving the full potential of the full transformative power of digital health will essentially be dependent on our ability to harness the power of digital health data for both primary use and especially for the secondary use. We desperately need high quality data. We've been hearing about that this afternoon and elsewhere and before to allow the biggest promise of digital health, the AI, ML, to develop, thrive, and to really start making real difference in real world. Meanwhile, not only the availability and quality of data remains a challenge, there are also risks related to our ability to ensure an equitable and ethical use of data and to make sure not to leave behind any potentially vulnerable population group as both the source, I should say, and also the target, the users of data, and thus avoiding various forms of data bias and digital divide. We've already spoken quite a lot about bias. So these are some of the points that we will be addressing in this panel. And I'm extremely honored to be joined by our wonderful panelists. Hosna Salmani, welcome Hosna. Mary Akangbe, Oladimeji Ewumi, Bryan Ogden, and Vincenzo Varriale. Now I'm going to ask our panelists each to tell us in few words about basically to introduce yourselves and to tell us in about 2 minutes what is the most important area of your practice and what is your passion in relation to the field. Shall we start with Mary, with you probably? Yes.
Thank you. Thank you. My name is Mary Akangbe. My background is minimally invasive surgery, robotics, and genomics. I'm the founder of Zenith Global Health. And because of my work in the innovative area in health, I've met lots of amazing people doing things across the world, especially EMEA. So my passion is to bridge that gap between the global south, global north, so that we can provide health equity, tech equity, and especially sustenance. And especially now that we are moving from clinical practice to digital health, telemedicine, how do we get the right things to the right people and involve the right people, which I think we'll be sharing more about in diversity, equity, and inclusion in data.
Thank you very much. Hosna.
Yes, in the name of God, hello, good afternoon. My name is Hosna Salmani from Iran University of Medical Sciences. I'm PhD student in Health Information Technology at Iran University of Medical Sciences, and I'm passionate about the intersection of health and technology, and I use my skill to develop an application for cancer patients. And I also won prestigious awards from several institutions like National Light Foundation and Youth Tech Health from USA that is sponsored by UNESCO. And also I'm a reviewer for HIMSS 23, which will be held in USA. Thank you.
Thank you very much. Oladimeji, would you like to go next?
My name is Oladimeji Ewumi. So I'm a freelance health writer, medical artificial intelligence thought leader, and a trained biochemist. So I help healthcare brands, life science brands, biopharma, and medtech with their content marketing strategy. And I'm most passionate about seeing how our AI can actually advance patient care. It's a pleasure to be here. Thank you.
Thank you. Vincenzo?
My name is Vincenzo Varriale. I'm a psychologist with a doctorate in psychophysiology. I'm also a co-owner and co-founder of a startup, Aequilibria Limited. We create tools to help to track cognitive decline in elders and to help them to stay cognitively healthy as long as possible. I'm very passionate of melting my passion, which is neurosciences, with technology and the creation of new innovative tools to help more people, elders people mainly.
Thank you so much. Bryan, tell us a little bit what you do and what your
I'm Bryan
passion is.
Ogden. I am the founder of Ninjamoba, which is an international, it's growing into an international consortium to reconcile different kinds of data through the use of conversational AI. There was 2 pilots, and they went to the same school, and they broke off. One went into the military, and the other one went into being a commercial pilot. And the pilot was flying from Belgium to the Netherlands, and this jet fighter flew right up next to the commercial flight, and he said, "Hey, buddy, remember me from pilot school?" He said, "Yeah." He goes, "Watch this." So he did some loop-de-loops, and he drove that plane right down to the ground, and he did a hammerhead stall, and he did all this military action, and he said, "Hi, what do you think of that?" And the commercial pilot said, all right, I'll show you something. And the plane continued on this Boeing 747 at 700 kph for about 15 minutes in a straight line. And then the pilot came on and says, "What do you think of that?" He goes, "What do you mean, what do you think of that? What'd you do?" "Well, I went back to the washroom, and I got me a cup of coffee, and I talked to that cute new stewardess, and I got a croissant." So that's what is important in inclusion and diversity and data. You can do all kinds of loop-de-loops. There's all kinds of things you can do with AI. But really, what do you want to do and what's feasible? What autopilot are we going to use with our data? And that's our work.
Thank you, Bryan. So before we proceed further, I would like to say that we'd like to make this panel very interactive as much as we can. So we'd be happy to take also questions from the audience. Just let me know whenever you have a question, and very quick introduction: who are you, what you do, and who the question is actually addressed. Or if any panelist could answer, that's fine as well. So Bryan, talking about equity, yeah, I'd ask you to dive deep in and directly into the topic.
Well,
we're speaking about equity.
I appreciate that. To go right for the quick, I have a controversial view about open data. So just to be frank, I'm not clear that everyone can leverage open data for its usefulness. You have to be capitalized to make any sense of data and to put it through the analytics and to deploy it in an appropriate way. So to have diversity and equity and inclusion in data, we need governance. We need really intervention into this space so that the large, already capitalized businesses don't just scoop up all the open data, and that the SDGs can be fulfilled, and that the little guys can get their access that they need in order to deploy. So it's important, I think, in my humble opinion, to do some kind of model. Like, I don't know if you guys are familiar with Unity. It's a gaming platform. And they allow free access to this amazing billion-dollar application that's gone through an IPO, free, until you reach a certain level of income. And then you have to pay. So if you're a big guy, you need to pay. And that seems to go along with EU policy that, you know, polluter pays. If you need to make an access of the data, you can leverage that, then you should be able to contribute, especially with public data. So in terms of public data, the monetization of that data should be returned to the citizens to a certain extent, in my humble opinion.
A good point, monetization. But Mary, we have a very significant imbalance, let's say, even in the quantity of data, let's say, between global north and global south. Let's put it that way, right? So it's already, I mean, we look at this heat map of what data the algorithms are based off, and we see, let's say, 40–50% of that coming from North America, probably 30% from Europe, and maybe just, a few percent coming from elsewhere in the world, right? From many countries in Africa, Asia, also Latin America. So how can we correct that, actually? What can be done to provide more data coming from basically places other than US and Europe, let's put it that way, and a few, a fistful of countries in the Middle East or in Asia. What do you think? Is there anything we can do? Because we know there's a lot of inequity to begin with, right? There is huge inequities in economy. There's inequities in healthcare per se. So is it possible for us to speak of equity with regards to data?
Yes.
What do you think?
Yeah, it is possible. And my take is that we go back to basics. Because we have this inequality existing already in clinical practice. We didn't fix it. We moved on to digital health, to AI and things like that, and now we are faced with the same problems. So what do? We start with clinical trials. Recently, Lancet published something that if there's any collaboration between UK, US, and any EMA, they need to specify the person involved, the number of data, the quality of data, before they will accept it for publication. And I think that's a good step forward. The other thing is, there was a study into diabetes, which we know it's largely, people who are largely affected are Black ethnic minority, and this was even in the UK. Only 1/3 can specify that it included language in the clinical trials. So we have to look at communication. We have to look at finances, of course, because the interpretation of the components or things that we're going to use is important. The other thing is, when we talk about data, we're talking about digital medicine, health technology. We have to lower the bar to come to these people's level, people we want to include in the data. How literacy are they in health tech or even basic computer? We have to take that into cognizance. Then we can get more on board. We need to work on trust. I mean, there's a lot that we have to do. And it will probably take us back a year or two, but we've got to fix it. Because before we can get to a state of health equity, tech equity, and doing the best for, global good.
Yeah, thank you so much for that, Mary. We're moving now, or we've touched a little bit on this, in this area of digital divide. We'll come back to it. But before that, I wanted to ask a question, Hosna. What do you think? Do we need more legislative efforts? Do we need a little bit more? Bryan was speaking of governance. Do we need more regulation? Do we need more efforts to ensure equity, diversity, and inclusion? Or you think it's rather culture change? Do you think it's going to take us time, or can we do something now or in the next years?
Yes, as we know today, everything is about data. We should focus on data, and we need to integrate data, and we see the integrate platform that data can exchange, can have shared between patient and provider. So if, for example, we have this type of data, we can see many institutions, university, hospital, everywhere, we can have access to this data, and they can use everywhere and every time that they need this. And also for this path, we should have a data governance strategy, and we should focus on the e-health strategy to see in the past, in the future. And when, for example, regulate the e-health technology, that nowadays patient-centered technology is very well-known, and usually the researchers focus on this type of technology. So if we can have a patient monitoring data, we need to have the focus on the quality of this data, and it's very important to see the path that we follow, and also behind this we should see the expenses and cost benefit of this technology that can, for example, collect and share, and also we have an exchange between the companies. And we can also follow board for this acquisition of data and access of data, and also we should have a integration and actionable insight for this to see which technology can suitable for this for our goal in organization. Thank you.
Thank you very much. Vincenzo, how would you describe, let's say, working with the elderly, people with cognitive dysfunctions? Now, there is, I believe, a very significant potential, right, with regard to equity and leaving basically some people beyond that digital divide. How do you addressing that? What do we do to make sure that the people who need these algorithms, the people who need digital health the most, frequently are those who are at risk of not being included, right? What is your take on that?
Thank you for the question, Prof. And we are working on this since a bit of time, actually. And yes, there is a digital divide, and elders are less prone to use technology for their health. Yes, this is true, but it's also true, in my opinion, that, for example, tablets, smartphones, this kind of very pervasive digital devices, they are digital devices actually, are becoming more and more diffused everywhere, also in elders. I know many elders who are using that kind of interaction. Of course, when you work with them, you have to create an environment which is adapted to the exigence of these people. The kind of interaction, the kind of interface, of course, but after all, they are using more and more this kind of technology. I think that using these devices can be a channel to outreach them, which are usually excluded, as you said, excluded from digital health, while they should be one of the first consumers, actually. So yes, and then I believe that the digital is all around them. So they use the digital every time they do anything at the moment. So I believe that this gap is going to reduce in the next years. We just need to prepare for this. I will be 16, 20 years, and I will still use a tablet if they will still exist, of course. I will still use. Then there are new technologies like virtual reality, for example, or augmented reality, for example, which are even more immediate. Another thing is the kind of interaction between the application and the patient or the user, which should be as much as simplified as possible, even passive if possible.
I think, yes, indeed. Thank you very much for that point. And I think we all understand the importance of, the human-computer interface, right? The user experience and user interface for making, for the technology to really enjoy adoption across the different population groups. However, are we going to, Oladimeji, what do you think? Are we going to have sort of a generational gap forever or not? Because the question is coming from understanding, let's say you mentioned tablets. All right, we are not native to tablets, so to say, right, our generation. Now our children are native, well, they're digital native, right? However, there will always be coming up a technology that our children will be less used than their children, and their children will be less used than their children, right? So is it going to be a challenge in the next decades, or alternatively, maybe it's going to be developing so fast because we know that it's exponential now that that the same generation will be facing challenges, adopting all that technology. What do you think?
In terms of our adopting technologies, I think that there wouldn't be so much of a divide. Yeah, because our research suggests that you have so many our aging populations now interested in utilizing a number of our social robots and AI and all of that. So, and in a way, it has actually bridged the gap. It has actually helped bridge the divide in healthcare, and even there are lots of our aging populations now who are also into telehealth medicines. Some wouldn't even, some people use the Fitbit technology and Apple or smartphones and all that. And I think because these interfaces have come up in a way that is actually consumer friendly and consumer readable, so it's easy for people of older the aging populations to actually read, or even have a child put them through on how to actually use this. So I really think that the divide is not going to be so much of that.
Okay, thank you for that. Do we have any questions from the audience in the meantime? Please let us know, if any. Bryan, we are going to have this huge amount of we used to call it patient-generated health data. Now it's rather person-generated health data. And speaking about commercialization, now all these sensors, right now, are they available to everyone? Is there any potential for inequality or inequity with the mere availability of all those sensor devices? How is that going to change? What do you think? What do we need for that? Do we need to pay? Do the health systems need to pay for that? Is it about reimbursement? Is it about is it more commerce? Then how do you make sure that everybody and the people are not underrepresented?
I think in the global South we have a pretty serious issue or technology gap, and that's what we want to address. I think all of the panelists would agree that we want to include those who cannot pay at this time, and we want to provide equity to everyone. That really the fruit of analysis and the fruit of human intelligence should be available almost as a right. Is data a right, you guys? Do you think data is a right?
I think that's why we have to be talking to each other, private, public, lawmakers, decision makers, strategic stakeholders, consumers. We all have to be talking to each other so that if there is enough financial sources or resources and human resources, then we'll be able to reach out to everybody, including making things that are products that are feasible and user-friendly, from age to gender to other ethical minorities, and also to consider the ethical implications of data, like consent. You mentioned governance, litigation. One has happened, more is coming. So we need to be talking to each other in that sphere.
Absolutely, yeah. We're unfortunately running short of time, but what came to my mind actually, do you remember how we tried to approach vaccines, COVID vaccines, right? Did we succeed there? I would be kind of a little bit doubtful. How many of you, ladies and gentlemen, in the audience, think that this paradigm, this vision that data is the right, will be fulfilled in the next 10 years? How many of you think that it will not? Thank you very much. On that, I think we're going to conclude our panel, and I think we owe a big round of applause to our wonderful panelists. And thank you very much.